Greetings from CGH. I'm Dr. Paul Steinke, CGH's President and CEO, and thanks for being with me now. A couple updates about what's going on in and around the hospital and in our clinics. First of all, it's great that we're starting to see some light at the end of the tunnel. As you may be aware, our clinics are now all open and seeing patients. We've increased our capacity in the operating room and procedural areas. So we are making sure to maintain social distancing, and everyone that comes into our facility is screened. I want to share that I do feel that CGH is a very safe place to come. All of our employees, all of our visitors, anyone that comes into the building is screened with a temperature and symptom check. Everyone wears a mask, even in our hallways, and we're doing our very best to make sure that this is an absolute safe place to be. While coronavirus is important, equally important and probably more prevalent are the other common medical conditions that we take care of, and we want to remind you not to ignore them. People are still having heart attacks. They still need their diabetes taken care of. It's important that you still get your mammograms to screen for breast cancer and colonoscopies to screen for colon cancers. So those sorts of things are still important, so don't neglect them, please. At this point, we are starting to ramp up in terms of our availability and ability to do cataract surgery and joint replacement surgery. Everyone who comes to the operating room is screened for coronavirus, so we want to make sure that this is a healthy place, and we're confident that we are. So if those needs are still out there, please get a hold of your doctor and inquire about getting things back into the schedule. Our telehealth visits are still available. That's where you can do a visit actually online, either in front of your computer, your iPad, or even on the phone. It's important that we keep tabs of your medical issues and address them so that more severe things don't happen. So don't neglect the rest of your medical care. So I do want to highlight a few things. We had some local nursing graduates, about 20 graduates. One of them was from Blackhawk, the rest from SOC, the SOC nursing program. Because of the situation we're in, they were not able to have a formal graduation, but we were able to do some pinning, nurse pinning and a graduation ceremony of sorts for those new grads. So send them your congratulations. And last but not least, I want to again extend our deepest appreciation for the community support that you've shown. It means so much to our employees that are on the front lines taking care of our coronavirus patients. There is light at the end of the tunnel. The number of infections are decreasing, and we hope that things will be more getting to normal as time goes on. I do want to thank everybody for their cooperation with our needs. The thing that's impacted folks the most is probably our visitor restriction, and I know that's been difficult at times. I hope that that will be changing in the near future based on our volumes and the number of COVID positive patients. So stay tuned for that. I don't have any changes at this point, but I anticipate that changing in the near future. Along those same lines, again, thank you for watching, and we'll get back together again when I have more updates. Thanks.